My name is Jim Calgar, and I'm the teacher representative on the District Insurance Committee, representing the Teachers Association. The committee's been in existence since 2009, and it has some guiding principles that I want to remind everyone of. We monitor our insurance plans and our usage in order to maintain a sound plan that meets the needs of all employees and the district. We also want to keep the cost of the premium and other costs associated with your health care at a minimum. Another thing that committee does is respect the fiduciary responsibility that we have to the taxpayers of the district to make sure we're spending our resources wisely and not overpay for insurance or overbuy insurance. Lastly, we want to make sure that we have an insurance provider and a plan that best meets the needs of our employees at the most cost-effective way possible. This year, for instance, we were facing back in January a 20% premium increase. The first step of the committee is to gain knowledge, so we spent a great deal of time seeking why that premium increase was so high. In this process, we use an insurance consultant, Mark Becker and Associates. The cost of that consultant is borne equally by the district and the employee groups that are represented in collective bargaining. One of the results of looking at that, studying our usage, was to recommend that we stay with United Healthcare as our provider. We also rely heavily on the employee benefits survey and the 2 surveys that are sent out by the collective bargaining unions. We also recommended changes in benefits, of which you'll learn more about, that would reduce the premium increase while having the least financial impact on employees of the district. Finally, we want to say that all employee groups are committed to working together to achieve our goals as a part of the insurance committee, despite any recent changes in the law. We will continue to evaluate both the market and the effects of any changes that we propose and are accepted by both the board and the employee groups. These changes that you're about to learn about on the PowerPoint are very important because it is very important to our work that you as an employee make the insurance choice in a knowledgeable, thoughtful way. That would be best for everyone, including yourself, as we don't want to spend any more on insurance premium than is absolutely necessary. That leaves resources here in the district for things like salary and all sorts of things the district needs to do. In conclusion, it's important for you as an employee to know that the insurance committee is a joint labor management committee. When we reach these recommendations or study an issue, we do it together. And any recommendations we make to the board or to the bargaining groups, we reach an agreement by consensus. We're very committed to working together to provide the very best insurance at the lowest cost possible and to achieve the goals of our insurance committee. We also want to continue to monitor both the marketplace and any changes, such as the ones we've made this year, as to their effect on cost and usage. Lastly, it's very important that you as an employee make an educated, thoughtful decision about your insurance. That is the best way we can ensure that our resources will be used effectively and efficiently and support a great insurance plan. Thank you.
Hello, I am Kathy Mabe with Mark J. Becker and Associates, and I am going to provide you with an overview of the Ankeny Community School District's insurance benefits and changes that will be effective July 1st. As always, I want to remind you that if you have a problem or a question, we encourage you to contact Lisa Daniels in the business office. Thank you. Today we're going to walk through the Ankeny Community School District's 2017-18 insurance benefit information. And this is the agenda for what we'll be walking through today. You see the insurance committee will introduce you to them, how insurance really works. We'll walk through a plan overview, show you the employee costs, a dental plan interview, flexible spending account, we'll walk through that, and talk about deadlines and forms. So here's the insurance committee with the group that's made up of the insurance committee. You can see the administrators, teachers, confidential, and support staff listed here. I'll let you read through that. We just want you to understand the work of the committee, that they've spent a lot of time and effort understanding the current benefits and costs. They look at the total package, the health insurance, life, long-term disability, as well as the voluntary benefits to make sure the school district and the employees get the most for their money. When they're analyzing the plan utilization, they take a look at how the overall district can manage the costs and how do they compare to other districts. They analyze the survey data that where you answer questions and submit that information. They take a look at plan design changes, and then there's recommendations that are actually made to the committee. The original renewal did start out at 27.3%, and then based on that was based on claim information through September 30th, and then it was negotiated down to 17.1%. And then looking at the different plans and the different plan options that are available, further was able to reduce that to 8.9%. And this took a lot of time and effort by the committee and took many, many meetings to accomplish this. We also want to share with you the history of the past renewals. So you can see we could go from 2011 with no increase up to last year with some of the plan changes that were made, a 5% increase. This information here is to help everyone understand some of what drives the rate increases. So you can see some of the large claims that are ongoing. And we also think it's very important that you understand your coverage and the costs. And so how do you do that? That's by attending the employee meetings or going online to Safe Schools. So this information will be out there for you to review at a later time, and also for like a spouse or partner, if you'd like to have them go ahead and review the information with you. Regarding the survey results, wanted to make sure that you have that information. Out of 867 employees that participated, 69% satisfaction with the overall network with United Healthcare, and 63% satisfied regarding customer service. This year, once again, we did not complete a request for proposal. That was due to the survey plan satisfaction. 80% of the survey participants favor a two-tier rate structure. What that means is single family rate structure. So we ask that question every year just to ensure that we're capturing what is most important to the employees. So what can you do now? We'd like to kind of set out an action plan so that knowing that the annual enrollment period will begin soon, we wanted to just kind of give you some ideas on what you can do. So it's really important that you learn about the benefits, and that's why we're going to have this recording posted out on the Safe Schools website so that you can actually go out there and take a look at it again later if you have any questions. We feel you should make a list of questions that you want to ask before you ever attend any of the meetings. Learn about programs that can help you and your family members stay healthy, and find out exactly how insurance works regarding out-of-pocket expenses and so forth. Other things you can do, make sure that you're getting the preventive care that's paid at 100% by the plan. Generic drugs, you can use generic drugs. Use participating providers to receive the most of a payment on your claims. Follow your doctor's orders, of course. Use the emergency room for true emergencies. And there's also options to make healthy lifestyle choices. So some of the terms that people need to make themselves comfortable with is understanding the deductible. It's a fixed dollar amount that the member pays for covered services each calendar year, typically before benefits are even paid. There's individual and family deductibles. The family deductible is usually twice the individual deductible. However, if one family member meets the individual portion of the deductible, benefits will begin to be paid for that person, and the rest of the family members can meet the rest of the deductible. We just don't make one person on this plan meet the full family before they have the charges paid. The out-of-pocket limit, that's important to understand. There's an individual and a family out-of-pocket. So this is the most the insured pays during the policy period, and that's usually a year. And the deductibles and out-of-pocket run on a calendar year basis. That's January through December for the deductible and the out-of-pocket. Regarding coinsurance, this is the member's share. When we say charges are paid at 80/20, that means the insurance carrier, United Healthcare, would pay 80% of a bill, and the member would pay 20%. There's also sometimes there's co-payment amounts, like with your prescription drugs, and with the co-payment amount, it's typically a fixed amount that the member pays for a covered service. So now we'd like to kind of walk through some examples here to help you understand how the member and the insurer share the costs. So in this first example, Jane has not met her $800 deductible. So she has $300 in outpatient surgery charges, and she is responsible for the full $300 because she has not met her deductible. So that will count towards her deductible, and she will receive an explanation of benefits that shows that, and the insurer in this example pays $0. Now, in this example, we are assuming that she has met her deductible, so the coinsurance part of the plan begins. Now, we can see that she had a $200 charge, so 20% of the $200 means Jane will pay $40, and the insurance company will pay 80%, or $160. So when you add the two together, you have the $200 charge right there. So that's the 80-20 coinsurance that we're showing right here. In this example, let's assume that Jane had a lot of charges in a year and she has reached her out-of-pocket, then she would receive 100% payment for the calendar year. So in this case, she'd met her out-of-pocket, she had $200 in laboratory costs, and so then she would have that paid at 100%. So again, remember the deductible and out-of-pocket is January through December, although you are enrolling effective July 1st for these plans. That's your open enrollment period. So now let's take a look at the medical plan overview, walk through your medical plan and some of the changes from this year. So the red indicates changes. So you can see that the deductible, and I'm talking about right now under participating provider, which is in network, and that's $800 that effective July 1st, and that was $750. The family deductible will now be $1,600, and it was $1,500. The out-of-pocket has stayed the same, $1,500 single, and that's before you get 100% for the calendar year, or $3,000 family. The coinsurance, that was 90-10, now it will be 80-20. You can see the office visits. Deductible is waived for an office visit, and that was 10% coinsurance. That will now be 20% coinsurance. The same with the inpatient, outpatient there. Prescription drugs, that has not changed. To the right, you'll see the point of service option out of network. That means you're using providers that are not part of the United Healthcare network. Single deductible, $1,500, family, $3,000. So that hasn't changed, nor has the out-of-pocket. What has changed is the coinsurance. That used to be 80-20, it will now be 70-30. Same with the office visits and the inpatient, outpatient. That is now 30% coinsurance where it was 80-20%. So a couple other plan changes. The bariatric coverage will now be excluded effective July 1st, and infertility treatment will be excluded. So without the rider, and that's the infertility rider that's currently on the plan, only diagnosis and associated standard lab would be covered. Without the rider, once the diagnosis is made, treatment would not be covered. So we want to just make sure you understand the reason that we were looking at some of these changes are because there are not very many claims at all in the bariatric and the infertility area. So we were trying to make sure that we were affecting the least number of people. So now there is a way to try to offset these changes. So I want to kind of walk through that right now. So each year you have the choice of enrolling in the flexible spending account plan, and you can decrease your taxable income. So for every dollar you set aside before your income is taxed, enrolling in the flexible spending accounts can save you approximately 30% in taxes. And again, of course, that's going to depend on your tax bracket. So if we use the example of a $2,600 medical expense, that could save you about $780 on your tax bill. We also recommend that you check with your own tax consultant. Let's say that you're having some higher cost items like the bariatric or the infertility, and you'd like to have those at least count towards your income tax. You could check with your tax consultant to see if you can claim this as a medical expense as a tax deduction on Schedule A. So again, you would have to talk with your own tax consultant regarding that. Then I wanted to show you the United Healthcare, some of their information. So you have packets of information you can obtain from Lisa Daniels. You have member e-services. There's help finding network doctors. You have access to explanations of the benefits, the EOBs online. You can complete health assessments. There are a lot of great wellness tools. And all of this is found on myuhc.com. Now, these are the same phone numbers and information from last year. This has not changed. And when we take a look down below at the Care 24 services, we really hope that you'll take advantage of this type of help, because these numbers are available, 24 hours a day, and very helpful when someone has a serious illness and they're looking for resources in the community and just have general questions. They can call and visit with registered nurses. And then we'd like to walk through some of the employee costs, show you what those are. So the teachers, the AEA, you can see family, $258.70 per pay period. Single will pay $0. For the 12th month, it's single, again, will pay $0. Family, $153.63 per pay period. And then for the 9-month, the single, $0, and again, family, $204.84. Okay, so then regarding some of the miscellaneous information, want to make sure and point out that one copay for $100 100-day supply with the mail order. So you have that option. That will save you some money. Also want to remind you the deductible and out-of-pocket maximums accumulate, as I mentioned before, on a calendar year basis. Premiums and benefit changes are on a fiscal year basis. The dental plan, premiums, benefits, deductibles, and plan year maximums are fiscal year, July 1st. They are not calendar year. So health is different from dental. So just wanted to make sure that and remind you of that. Regarding retirees, coverage is to age 65. So the employees that are currently enrolled can continue coverage up to 65 if they take early retirement by paying the full premium. Some of the other information we want to make sure you're aware of is voluntary benefits are available to all staff working 10 or more hours per week. The insurance carriers involved, Avisa's Vision, Aflac, and Colonial Life that this would pertain to. Also want to make sure everybody understands that regarding the flexible spending account, due to the Affordable Care Act, employees working on a part-time basis will have their hours measured on a yearly basis to verify eligibility for health insurance. And if the employee works an average of 30 hours a week, an offer of coverage will be made for the following 12-month period. And then regarding the flexible spending account or FSA eligibility, the ACA does restrict enrollment in the FSA to full-time employees only. So once again, remember, if you have any questions, customer service issues, please make sure and contact Lisa Daniels. And now we'll walk through the dental plan summary and rates. Those eligible are administrators, teachers, and confidential staff. No rate increase effective July 1st, and the rates for the dental plan will be $28.23 per month single and $99.15 per month family. Do you want to again make sure and remind you, as I said before, that benefit year for the dental runs from 7/1 through June 30th. Now this gives you an example of the benefit plan design and the options you have. You have what's called a PPO plan, although you can use the PPO or Premier providers, or even if the provider's out of network, you can use those also. However, you will pay more out of pocket. So here we have the maximum benefit amount. You can see with the PPO, it's $1,000, same across the board. And that's for every member of the family. So if I have 3 people in the family, we each would have $1,000 per year. Annual deductible, and again, that's July 1st through June 30th. $15 for the single under the PPO, $45 family under the Premier. And the out-of-network, you can see that you would pay a little bit more. So whenever you can use the PPO dental providers, it will cost you less. For preventive and diagnostic care, you'll pay $0. Routine and restorative, you can see that it's 90/10 on the PPO side and 80/20 Premier and out-of-network. Regarding endoscopic and periodontal, it's the same across the board, 50/50. Dentures and bridges, again, 50/50. And then the ortho lifetime maximum, that's $1,500. Now, I do want to tell you that when, if you're a member and you are going to have new orthodontia claims for members of your family, the payments are made quarterly for new claims after April 1st. So maybe you've had a child a couple of years ago and those claims may have been paid monthly. We do want to make sure and tell everyone new claims will be quarterly after this. Okay, regarding the PPO Plus Premier, we just want to show you the number of providers in the state of Iowa and the United States that participate with Delta Dental. So you can see 44% of Iowa dentists regarding the PPO, 54% of the dentists in the United States. Then down below, we show the Delta Dental of Iowa Premier. So you can see there are many more providers with the Delta Dental Premier, 93% of Iowa, 79% nationwide. So you shouldn't have a problem finding a dentist that at least participates in the Premier. Now here we'd like to show you some of the potential savings. So we'd like you to take a look at the PPO versus Premier and out-of-network. So you can see that we're showing you an example of a $225 charge. And then we go on down and show you how it's processed. So the bottom line is at the very bottom, enrollee total payment for this $225 bill. If the person had the PPO, and we're seeing the PPO provider, I should say, they would pay $12.80. With the Premier, $41.40, and then with the out-of-network, they would pay more out of their pocket. So again, it does pay you to use PPO providers if you can locate one that you'd like to use. Otherwise, the Premier is fine. So some of the member advantages that you've had access to over this past year, you can go to deltadentalia.com and find a provider, take a look at claim status, you can print your explanations of benefits, you can also order ID cards and get customer service questions answered, or you can call them on their toll-free number also. There's subscriber oral health information that's really good for you to take a look at out there on deltadentalia.com. We do recommend that you get signed up out there so you have access to your explanations of benefits and so forth online. As with most companies, you do have advantage. You can take advantage of their app. So then we'll move on to the flexible spending account. So the flexible spending account allows you to set aside money from your paycheck with pre-tax dollars for eligible medical and dependent care expenses. The medical is $2,600 per plan year. This past year it was $2,550, and so the IRS is allowing that to increase this year in 2017. And Ankeny has agreed to go ahead and increase that for you. The daycare has been the same for a number of years. And what's really nice is the district pays the administrative fees. So a lot of people ask, why should I even enroll in the flexible spending account? How does it work? So this will help you decrease your taxable income. So as I showed you in the examples before, you take a look at your own tax bracket, but if we use the example of $2,600 in medical expenses, you would save approximately $780 on your tax bill. And you can take a look at the dependent care here, and we do tell people, talk with your own tax consultant. Is it better for you to use the flexible spending account for dependent care, or should you go ahead and claim that on your taxes at the end of the year? So you're able to get reimbursed for eligible medical, dental, vision, and daycare expenses with pre-tax dollars versus post-tax. So we highly encourage everyone to take a look at this each year to ensure that you're getting the most out of your benefit plan. So how does it work? You need to take a look at your elections that you want to be contributed pre-tax. The best way to do this is estimate what you expect to pay in medical and dependent care for the coming year. We always tell people make sure that you're very conservative because it does have the use it or lose it feature. That means at the end of the year, if let's say I claim I'm going to have $2,600 flow through the flexible spending account, and I get to the end of the year and I've only used $2,200. Well, I can tell you that I'm not going to lose my money because I'm going to find something else to use that on. For example, maybe I can buy a new pair of eyeglasses, get my teeth cleaned again. So there's always a way to do that. However, through the past years, I really haven't seen anybody lose the money because there's always something you can find that's an eligible medical expense to use. So regarding the medical elections and making changes, you can only make changes if you have a qualified event like birth, death, marriage, divorce. Dependent care, you can make a change one time during the plan year, effective January 1st, for example, if your expenses change. Remember, each paycheck, you're going to have your prorated election amount will be pulled out of your account, pulled out of your paycheck, and put into the flexible spending account, and that'll be pre-tax. Once you're able to incur eligible expenses, then you'll receive that money, and it's pre-tax then. So we want people to be conservative, and we want you to be informed consumers as far as what you're going to spend the money on. So we'd like you to take a look at this list here and just be thinking about what did you spend last year that maybe you should plan for with the flexible spending account this next year. How many times did your family go to the doctor? How many prescriptions does your family use? And again, here's a little chart here to help you take a look at what different people have used in the past, just to help you kind of determine what you might use for yourself, a spouse, and a child. So again, very important to determine what your expenses might be in the future. Some questions you might want to ask yourself, are you planning for a baby? Do you need to be thinking about the OB checkups and so forth? Do you have a child that's going to be going off of your plan because they're turning 26? Or do you have somebody that has ongoing treatment that's going to be split within plan years? So you need to be thinking about things like that. What type of plan do you have? You have what's called an HMO plan. However, it has a point of service, which means if you see somebody outside of the network, you still have benefits, but you'll just pay more out of pocket. So again, these are just some things for you to be thinking about. So how do you submit your claims? You submit your eligible expenses for reimbursement to TASC. That's the administrator of the flexible spending account. You can mail or fax online by following up with the receipts as a fax, tax debit card, or smartphone mobile app. We always tell people hold on to your receipts for your records just in case TASC would request them. And also we tell you you should hold on to those regarding the IRS just in case you're ever audited, because remember, you're claiming that these are pre-tax expenses. So here I'd like to take a look at some of the medical reimbursement account and some of the qualified expenses and be thinking about changes from this past year. So you're going to use pre-tax dollars to pay for co-pays like your prescription drugs. Deductible, remember that's up $50 on the single and $100 on the family. The co-insurance was 90/10, that's now 80/20. You also might have some eligible dental expenses that you're paying out of pocket, or vision. Certain over-the-counter medications written with a prescription. There's also a detailed list of the eligible expenses if you want to go out to irs.gov and take a look at that. I also remind people about what we call the uniform float, which you have with the medical reimbursement account. Now what this means is, let's say for example, you sign up for $1,200 over the course of the year to come out of your paycheck. So it's put in the account, $100, let's just say per month comes out. And then in the first month, let's say July 15th, you end up having $1,200 in expenses. Well, because you are going to have that money in the account over the next year, the IRS allows you to have the uniform float. What that means is I now have access to that full $1,200 because it will be in the account over the next year. So that's the uniform float, having access to the elected amount basically available on day one of that plan year. The dependent care account, that does not include the uniform float. You would have to incur those expenses and be paid with money that's actually in the account. You don't get the benefit of the float. Pre-tax dollars you'll be using to pay for dependent care for children up to age 13, dependent adults or disabled children in certain examples, preschool tuition and fees. Okay, so regarding new and re-enrollment information, full-time employees only, and again, this is due to the Affordable Care Act, the ACA that we mentioned earlier. Re-enrollment is not automatic. You must enroll each year. So even if you enrolled this past year and currently are enrolled in the plan, you do have to re-enroll. If you're a new participant, you have not been enrolled in the past, you will receive from TASC a participant number, a PIN number to access online information, and a debit card. Regarding the TASC debit card, how it works, new elections are going to be loaded onto that card. These cards are going to be good for 4 years, and if you need to have one reissued, it'll be $10. And you can get one additional card for spouses and dependents that will be free of charge. And then there's also a $10 fee for each additional dependent card. You can get a maximum of 3 dependent cards. That can be requested. The TASC card features 2 different accounts on the one card. So what that means, you have the My Benefits side. You use this to pay for eligible expenses at the point of service. So for example, I go in and I buy a prescription, and let's say I have a $50 copay, I'll swipe that card and that'll take the $50 out of my TASC account to pay for that $50 copay on my prescription. Or you also have what's called the MyCash side, and that's where it deposits the non-TASC card reimbursements. Let's say maybe I had to file a paper claim and then I received reimbursement that was directly deposited onto that MyCash account side. And then I'd have access to that money to be able to use at a later time. So the MyCash feature, this affects the non-debit card transactions, as I just mentioned, and participants that are not signed up for direct deposit. So you could sign up for direct deposit if you wanted and have everything just directly deposited into your checking account. So if you use your debit card or if you're signed up for direct deposit, it doesn't impact you. The reimbursement for non-debit transactions will be deposited on the MyCash side of the card. No paper checks will be mailed with the TASC account. So we just want to make sure that you know that it's either direct deposit or the money is put into the MyCash side of the card, which gives you access to that money. So the way that you access those funds on the MyCash side is you swipe that TASC card at any of the merchants that accepts MasterCard. You can also use that to withdraw at an ATM, or you can transfer that money to a personal bank account. So regarding the MyCash feature, MyCash funds can be used to pay for eligible expenses if no funds are available. On the My Benefits side of the account, you can combine general retail items with eligible healthcare expenses into one transaction. So if you want to participate but have direct deposit, you have to go online and turn off that direct deposit feature. And if you don't want to participate and are not signed up for direct deposit, you must sign up for the direct deposit online. So remember that you'll receive information how to access everything and get online with TASC. The plan year for the flexible spending account runs July 1st through June 30th, July 1st of 17 through June 30th, 2018. And you do have 90 days at the end of the plan year in order to submit your requests for reimbursements from the current plan year funds. So as of July 1st, 2017, you'll still have 90 days to be submitting expenses from the previous plan year. Now remember, your plan year overlaps a tax year, so this is important for dependent care expenses to be planning ahead and thinking of that. So if you want to track your activity on your account, you can go to MyTASC, which is the taskonline.com. MyCash Manager, so that's within that website also. You can use the mobile app, and you can also use text messaging with TASC. They make it very easy to work with. So now let's talk about the process and enrollment dates. Something new this year for 2017-18, now this is pending successful testing of the enrollment database. All insurance and flexible spending enrollments will be completed through the Employee Access Center. We'll refer to that also as the EAC. So tentative dates for the open enrollment period are April 27th through May 12th. So make sure and be alert to any emails or any information you receive from Ankeny regarding this. So full-time staff and part-time staff electing a voluntary benefit must designate their benefit elections in the Employee Access Center. So during the open enrollment period, the annual benefit election button will be visible and staff will click on the button to access their enrollment options. Enrollment has to be completed by May 12th, or the staff will have to wait until the next open enrollment unless you have a qualifying event. So again, stay in tune to make sure and understand what that open enrollment period is. Right now, we're saying that it's going to be April 27th through May 12th. If you don't elect as of May 12th, then you will have to wait until the next plan year, the next open enrollment period. Now, if we do have a staff member that has an issue that prevents enrollment through the Employee Access Center this year, a paper form will be provided this year only. So just so you understand, it's with the agreement that for the next plan year, the member will agree to enroll through the EAC. So I know that Lisa will be more than happy to help people understand this system and make sure that you understand how to enroll. So make it as easy as possible for you. So I'll leave that up for a minute so you can kind of take note of that. And then we also just wanted to remind you regarding the supplemental life enrollment. Supplemental life can be purchased at any time by the full-time staff with evidence of insurability. And that means you would have to answer health questions, since we're not going to have an open enrollment for supplemental life. So you can contact Lisa Daniels if you would like to purchase supplemental spouse and or dependent life insurance. And so with that, we'll end this webinar, and please feel free to go out at any time and continue to take a look at this video webinar so that you can take a look at the PowerPoint and share it with other family members. We thank you very much.